barriers in dialysis patients during the COVID-19 pandemic. My name is Alexandra Cruz, and I'm going to be the host today. And just a couple of housekeeping items. This WebEx, I just started the recording, so the recording and the slides will be available to you after today's call. All lines except the speakers, as you guys noticed, are muted right now just to eliminate background noise. But we want to talk with you, communicate with you. So if you have a question and you want to participate, you may raise the hand by your name if you are connected in the computer, and I will be able to unmute your line. Also, you have the option of using the chat and Q&A features at the right side of your screen. So make sure that you're choosing either all panelists or the host. Same for the Q&A. You're able to send us a private question, or if you want to share your question or comment with the group, you can do that to all participants as well. So today we have a couple of speakers. We have from MAS, Rob Sekring, Ricky Rodriguez, Brian Cohen, and from the New York Department of Health, we have Josh Blair and Bob Schmidt. And you'll also be hearing from the ESRD Network of New York, we have Anna Bennett. So thank you all for joining us. I'm going to be passing it to you, Rob, and I'm going to pass the controls to Brian.
Okay, thank you, Alexandra. We really appreciate being invited to talk about our best practices in the state of New York. We have a great relationship with the Department of Health, they're also on the phone, and I'd like them to kick it off. I'll go quickly through the agenda on the items that we want to cover. You know, I think that in New York, I think everybody knew with COVID coming in, we got hit first and the hardest by far. And so we had to react really, really quickly. So just real quickly, we're going to go through a brief intro. We're going to talk about the early challenges that we faced with COVID-19 in New York State. We did take some early actions by the Department of Health and Medical Answering Services dealing with the pandemic. The challenges relating to transporting COVID positive, we call them enrollees, most of you call them members. We want to talk a little bit about the outreach that we've had with transportation providers and medical facilities. Obviously, the emphasis today is dealing with dialysis facilities, which we have grown to have a very, very strong relationship in the state of New York with their teams. I know Brian's going to be talking about our dialysis outreach and how we bridge the transportation challenges with the dialysis facilities. And then we want to share our contact information. By the way, my title is Executive Vice President for Medical Answering Services, and so we'll go over that a little bit. So that's the agenda. Brian, if you want to advance, and I'm going to let Bob or Josh take over with the introduction of New York State Department of Health.
Sure. Good afternoon, everyone. This is Josiah Blair from the New York State Department of Health. Just some background on us. New York oversees 6 million Medicaid enrollees. We have an annual transportation of expense of right around $1 billion. Our main responsibility is the development of policy for Medicaid transportation in New York State. Because of the size of our program, we utilize and oversee transportation managers in a fee-for-service model. We coordinate with federal, state, local partners. We develop the reimbursement schedule, or our fee schedule. And in moments of emergency and disasters, we develop plans and utilize our managers to get those plans taken care
of. Okay. Thanks, Josiah. And just a little intro of Medical Answering Service. We are the transportation manager for 60 of the 62 counties, which accounts for about 80% of those 6 million enrollees that Josiah mentioned. So we're responsible for we're responsible for the transportation of 5 million enrollees, and which adds up to around 15 million trips per year to and from the enrollees' appointments. So let's talk a little bit about New York State and what happened. I don't think that there's any secrets here about what has occurred, but what we put up here was the hospitalizations that occurred. And as you can see, as everybody kind of knows, we flattened the curve quite a bit from June onward, and it's very, very flat. And I think that's for a lot of different reasons. But it hit us like a freight train coming in in March and April. And as you can see from the graph, April 1st area was really, really high as far as hospitalizations, and then deaths followed. But we were in the middle of it rather quickly. Okay. So I want to toss it back to the Department of Health because I think that we took early actions, and I think this was very beneficial for us. But I'd love for Josiah or Bob to go over the things that they did with the New York State Department of Health in working with transportation providers. The one thing I will add is, as opposed to a full broker model, which many of your states have, in New York State, the transportation providers actually work for the Department of Health. We work as a go-between, making sure that they have the trips, and we help manage the transportation providers. But the actual contract is with the Department of Health. So Bob or Josiah?
Sure, thanks, Rob. So early on, we knew that it was really important to get guidance out there to our transportation providers. We sent that out in 3 different types. We sent out some guidance on cleaning and the hygiene requirements. We mostly use CDC guidelines to come up with that. We prohibited multi-loading, and that policy is still in effect today to help curb the spread of COVID. And we looked at PPE recommendations, again, going to the CDC as well as OSHA for guidelines for those. Finally, we set up a command call center in our state capital. This gave us direct access to the governor's office and allowed us to coordinate with other agencies directly. And we had also asked MAS to manage transportation for those who they were not contractually obligated to do in discharges from places like the Jacob Javits Center.
Okay, great. Brian Cohen is one of our vice presidents of MAS. Brian, do you want to take us from here for a little bit?
Sure. Thank you, Rob, and thank you, Josiah. A couple other actions we took early on in the pandemic was the establishment of this patient management care coordination line. As Josh stated, we established this line dedicated for COVID-19 transport for both Medicaid and non-Medicaid transports, including some members of those nursing home associations to and from their medical appointments, which included dialysis. This line was staffed 24/7. And because of the staffing of this line, we were able to get multiple patients the services that they needed when they needed it most. We worked with DOH to develop the tracking tool for those non-Medicaid trips and payment of those TPs, considering that is outside our normal scope of work. That took some coordination with the Department of Health. So that was established and staffed 24/7 while it was needed. We also, at that time, we also did a lot of work with IPRO ESRD of New York State with Anna Bennett, and we'll talk a little bit about that more later on in the presentation. We also did quite extensive outreach, and we're going to cover an entire slide on just the outreach that we accomplished, but it was really through that proactive outreach we were able to stay ahead of the challenges that were presented to us, and I'll get into those details in a little bit. To talk a little bit about the Javits Center and the USNS Comfort in New York City, the Javits Center was open from April 11th to May 1st. The Comfort ship opened April 18th through April 27th. We were asked by the Department of Health to put together a team to staff on site at the Javits Center to facilitate transports to and from alternative COVID medical sites for all patients with or without insurance. We worked closely with the military to arrange transports out of the USNS Comfort following those same procedures. And once the number of patients at those centers decreased, we were able to transition to remote management of those transports through our contact center, and we were able to get the team out from on site there. But those were all successful in transporting those patients who needed that service to and from. And another thing that we found early on was to meet the need, there were plenty of testing sites popping up. I think there were just over 110 total across the state that popped up as alternative testing sites. And we made sure that those addresses and those locations were built into our system so that transportation could be requested to and from seamlessly. Now, to talk a little bit more about what happened at the Javits Center, I would like to turn it over to Ricky. He was one of our team who was on site at that location. Ricky, do you want to speak to anything else that might have happened at the Javits Center or the USNS Comfort?
Sure, thank you, Brian. I'm the general manager of the New York City area. I work directly with Brian Cohen, managing the New York City outreach team. Again, we were asked to assist with transportation at the Javits for the alternative COVID medical sites. It was a team of 10 members from MAS, including myself. We worked closely with groups such as HEC, which is the Evaluation Coordination Group, the military, which consisted of the Army, Coast Guard, and the Navy, Department of Health and Mental Hygiene. We also work with the Bureau of Emergency Management, which is BEMS, and a group of caseworkers and doctors from Northwark. We work with all parties to coordinate a workflow. We put together a team of transportation vendors.
Hey, Ricky, I'm sorry to interrupt you. There is like an echo coming from your line. I don't know if you have maybe a laptop closed, if you can open it just slightly, or maybe a phone nearby that it might be creating some frequency.
Okay. Let me move around a little bit. Okay. And let me proceed on. We work together with a team of transportation vendors that were willing to transport COVID positive patients. We utilize smart sheets to keep a log of the patient's information. The development of this tool allowed us to track all transports scheduled, the patient's medical coverage, if any, the mode of transportation, the vendor assigned to the trip, and the trip destination. We also use the same method for the USNS Comfort.
Hey, Ricky?
Yes.
Ricky, I'm gonna jump in because the line I think is getting a little bit worse. Let me maybe take over here real quick.
Okay.
All right, thanks. Thanks so much. And Ricky was on the ground there every day putting this together. I think the most important thing here, two issues. One was the patients we were transporting to and from the Javits and the Comfort were 100% COVID diagnosed patients. And so our key issue there was coordinating with transportation providers, assuring that they had the equipment that they needed in order to take the appropriate safety precautions, utilizing PPE and universal safety precautions. It did take a lot of communication with those providers. We did have some providers, I think Brian will probably get into this, but we had some providers who reduced their number of transports. We had some providers who had drivers who became COVID positive. So we did have those issues, but I can tell you for the most part, I would say that 98% of our providers pretty much stayed up to their regular volume or desire to keep the number of vehicles on the road. That was done because, in my opinion, because of the positive approach in New York State with what the expectations were, that these enrollees had a very, very critical need to get to and from appointments. I will say, Brian mentioned the pop-up testing sites. We also had pop-up dialysis centers that came in New York, which was something that was new. They were dialysis centers that were just for COVID positive patients. So that was a big issue that our providers thankfully stepped up to the plate and took on those patients and did them very well. As Josiah mentioned, we eliminated the state eliminated the multi-loading, and that still is in place today. There's no multi-loading that's going on in New York State for non-emergency transportation. So Brian, let you pick it up from there.
Thank you, Rob. So to expand on some of those challenges that Rob was mentioning, what were those challenges that we encountered early on? So one, and I think this is no surprise, one was around the PPE and disinfectant products and the shortages that we were experiencing with that. There was limited supply, and transportation providers were concerned that they wouldn't be able to meet the need because of the lack of supply of PPE. In some situations, we had some medical facilities that were able to provide PPE to their transportation providers so that services could continue. And in some other cases, we had to look to other resources. Another challenge was the transportation provider's comfort level and willingness to provide transport. We were dealing with the unknown. Drivers were scared. They felt unsafe. And same thing goes for entering the facilities for those door-through-door transports. Again, they felt unsafe to enter those facilities. So there was a lot of communication between transportation providers and the medical providers to work out some alternative procedures, such as specific entrances or exits dedicated for those transports. In some cases, we work with medical facilities and their staff to help deliver the patients to those entrances and exits so the transportation providers wouldn't have to enter those facilities. And as Rob mentioned, because of the uncertainty and quite frankly, the fear that was out there, there were some transportation providers who reduced their services due to a shortage of drivers. And we were concerned that if that continued, we might see an issue with available resources across the state. And through our proactive outreach and our relationships and constant communication with stakeholders, we were able to really address these challenges head on very, very early on. For every provider that reduced their service or closed altogether, there were 2 more that popped up that said that they had the available resources and were looking to fill the need. So luckily, we were able to meet the needs of our patients, even with some transportation providers reducing their services or closing. There was also a lot of communication, needless to say, with medical providers and their need to efficiently modify schedules to meet the transportation needs during the pandemic. Some needed to implement social distancing, others needed to make sure that they had available resources to transport their patients. So much was happening so quickly during this uncertain time. We needed to ensure that our stakeholders were comfortable using our efficient mechanisms to arrange transportation. Doing so online allows them 100% visibility of their patients' transportation schedules and quick and efficient options to modify those schedules and present to them what available resources were out there that they could use for their patients. So really it was the outreach with the folks that we have great relationships with that helped us stay ahead of these challenges. One of the things we did is we connected with each of our public transits. We work with about 26 public transits across the state. We reached out to 100% of them on a daily basis for several weeks. We've recently moved that to a weekly outreach, but that outreach is ongoing. We needed to learn what their operations were during the pandemic. Were they reducing services? Were they closing down altogether? Were they still charging fare? And in some cases, the transports that were assigned to those public transit agencies had to be reassigned to providers that were conducting services still in the region, and we were able to make those reassignments to ensure that patients got to and from. We work with as far as the other transportation providers, we work with over 1,500 across the state. And our initial outreach included the dissemination of the DOH and CDC guidance to each of them through system messaging and through that outreach. Again, as Josh mentioned earlier, it was around cleaning and disinfecting, hygiene requirements. The prohibition of multi-loading was very important to make sure that patients weren't being grouped in vehicles and they were being transported one at a time. PPE recommendations, we talked through all of that with the transportation providers. One of the major parts of our outreach was to make sure that we did have available resources. We ask our transportation providers to indicate in our system what their capacity levels are, what the number of transports they can take on a daily basis. And we reached out to our transportation providers, the top 100 to start, to make sure that their capacity as listed in the system was practical and up to date so we could keep a close eye on those available resources. We needed to make sure that as the facilities in New York City began to meet capacity and were starting to get overwhelmed, we needed to make sure that we had resources available throughout the state if called upon, if those transportation providers would be willing to transport patients out of New York City to some alternate sites upstate to kind of spread them around to make sure that those facilities in New York City weren't becoming overwhelmed. And through our outreach, we found over 50 transportation providers across the upstate region that would be willing to drive down to New York City and transport those patients out if needed. And even still to this day, and this started back in March, we're conducting ongoing what we refer to as health and wellness checks with our stakeholders to listen to concerns, hear feedback, and stay ahead of challenges through those communications. We did a small sample daily. We've recently moved that to weekly outreach. We've made just under 2,000 calls, and those calls are ongoing. Again, it's really meant to keep our fingers on the pulse of what's happening out there. And as I said earlier, we did find some transportation providers were reducing services or suspending services altogether. But again, for every situation we found a provider closing, we found 2 more who were prepared to meet that need. This also included, of course, as I mentioned earlier, extensive outreach to medical practices. There's thousands of medical providers we work with across the state, and I'll talk specifically about dialysis on the next slide, I believe. But just to talk through our general outreach, we reached out to these providers statewide to talk through best practices. Are they sending their patients out with masks? What type of appointments are going to be continuing at those locations versus which transports should be canceled, as elective surgeries and other medical services weren't continuing during the pandemic. Are they conducting temperature checks before they release their patients? Are they even open as a facility and still seeing patients? These discussions made it possible for us to keep our fingers on the pulse and stay ahead of challenges. There was a lot of education and support, and still a lot of education and support going out to medical providers, educating them on the guidance that was provided to transportation providers. There was a lot of questions around that. What are transportation providers allowed to do during the pandemic, or what we should be expecting of them? So we reviewed that guidance with medical providers, educating them on how to use our efficient resources, our online tools, which really save them time from having to call into the call center. Being able to manage their transports right online really makes it simple and efficient for them. And then how to find available resources, right? How to know what resources, what transportation provider resources are available to meet the needs of their patients, where to find that, who to reach out to, key resources at MAS, making sure that they knew who their field team member was. We have agents stationed across the state working in the field with stakeholders in their region, and we made sure that the medical providers knew how to reach them. We did a lot of relationship building with transportation providers and the medical facilities. We've connected facilities with their preferred transportation providers to talk through procedures for transporting patients and outlining expectations in advance. Scheduling online allows the facilities to have 100% visibility into the transport schedules for their patients, including who that patient might be riding with, so they knew who to reach out to. If there was an immediate need, they could reach right out to that transportation provider to address that immediate need. We also talked through things with the medical providers and the transportation providers around PPE and the wearing of masks, and if there were to be temperature checks conducted and so on. It was a little bit different at each facility, so we made sure that the transportation providers knew what they could expect from those facilities. And just like the transportation providers, there's ongoing health and wellness checks daily for a while, recently moved to weekly, connecting with those facilities to listen their concerns, hear their feedback, and stay ahead of those challenges. To talk more specifically now with dialysis and the engagement we have with dialysis facilities. So, early on, we recognized that dialysis was going to be an important stakeholder because those patients needed, patients need to dialyze. It's a life-sustaining treatment. So we really wanted to focus on those life-sustaining treatments, such as dialysis, to make sure that transportation went on without a hitch, so to speak. So we started this by what we refer to as our listening tour, learning as much as we could about what happens in the world of dialysis social workers and at the dialysis clinic, so we can make sure that we were presenting to them the most efficient tools and making sure that they had access to those available resources. One of the things that we heard most was that social workers can become the overall care managers for their patients, given how involved they become with those patients. And there's so much happening and there's so limited time to get in all of the functions that they need. So they didn't have a lot of time to spend on transportation. So again, it was about providing that education and that ongoing resource to help them through navigating the NEMT benefit. I know that Ricky is having some challenges with his line, and I did want him to speak a little bit to our engagement with ESRD of New York State. Ricky,
Brian, I think I'm good.
I think you're good too.
Now.
You sound good, Ricky. So why don't I turn it over to you? You could talk a little bit more about the engagement with Anna Bennett.
Yes, sure can. During the peak of COVID, we were in constant communications with Anna Bennett of IPRO ESRD network of New York, actually daily. We work with Anna to resolve any concerns. We work with Anna to gather information for the satellite dialysis locations. Those locations were where the COVID positive enrollees were taken. We were able to get those addresses verified and added in the MAS system. We were able to get the standing order set up for those satellite locations so patients would not miss any appointments. We were able to assist with transportation for a couple of nursing homes, if I stand correct. We arranged transportation for the nursing homes. We got those enrollees to their dialysis appointments. We were in contact with the vendors, as you stated, daily, making sure those folks got to their appointments. We were able to get those enrollees to their appointments without any issues. And as you stated, due to our relationships, our relationships were key in these situations. Anna, would you like to add anything? Did I miss anything, Anna?
I'd love to add some more, Ricky, and especially for the audience to understand that you've heard about the processes that were developed by MAS to help us. And what does this mean at the dialysis facility? This means that the 15,000 patients being treated at 133 facilities, probably now 142 dialysis facilities in New York City, especially the metropolitan areas, got hit the hardest. We were able to help get access to care, and that meant that we used the 10-minute rule here at the network. If in the middle of a crisis, you have a staff member who is having and struggling with transportation issues, if they can't solve that problem in 10 minutes, call the network, send us an email, see what we can do to escalate the problem. If it weren't for the provider staff at those 130 plus dialysis facilities letting us know what's happening on the ground at the dialysis facilities, we never would have been able to make the connection with MAS to let them know what our needs were as a community. And it was beyond Medicaid fee-for-services. Okay, so MAS was contracted for all the Medicaid fee-for-services patients. They're the provider. They work with their drivers and get them back and forth to dialysis. In addition to the Medicaid fee-for-service, we had problems with disability transportation, volunteer transportation, patient transportation if they were self-driving, they were COVID positive. And because we also were working with the state, MAS, and the Office of Emergency Management in many counties, the state was able to react and create a hotline that was able to help us with even those patients that didn't have fee-for-service Medicaid. So MAS could step up to a plate, and if we had a problem with disability, we could give them a hotline number, and then the social workers could schedule something during the height of the pandemic. So in March and April, we had 91 calls into the network about patients who couldn't get to dialysis. And that was just in the first month. So what we were able to do to coordinate all of this and to work, when Ricky says we were on the phone every day, the network is 24/7 now, and it's the same in the South Atlantic. Alex and all the people that work at the South Atlantic network are 24/7. There's someone at the end of the phone or your staff is having a problem. So at 10 at night, when we have a driver who's completely freaked out and won't bring a patient back home from the dialysis clinic, we could talk to Ricky, and Ricky can have another driver that would step up to the plate and bring that patient home. So these are the things that can help your dialysis staff be less stressed in a situation that's just, we're going to be feeling the ramifications from this for decades going on. But the practices that we developed and the relationships that we developed with the Department of Health, with MAS, and with those drivers is going to help us going forward. We'll better prepare for wave 2, and it really is going to help us going forward with all the transportation issues that people in dialysis clinic know we have, because, our patients can't self-isolate at home. They have to go to dialysis 3 times a week. Our drivers are frontline, first responders in this case. They're exposed to COVID-19. And so MAS could support them so they could work within the community and serve the community. So use the network as a resource, and then the network can work with transportation providers, with the OEM, with the State Department of Health, and hopefully alleviate some of the stress that happens in your dialysis clinic. Now, did I miss anything, Ricky?
Mm-hmm.
Nope.
No, that was great. Thank you, Anna. Thank you, Anna, and thank you, Ricky. To talk a little bit more about the work that really Anna Bennett was really so very helpful, and she really acted as a conduit for us to make sure that we were able to connect with all dialysis clinics, not just those in New York City, but statewide. You've been really, really helpful, so I just thank you again, Anna. One of the first things that we did early on when we started speaking with Anna is we put together a series of webinars. We hosted a week's worth of webinars for dialysis clinics statewide to exchange basic information, contacts, talk through things like forms and system access, some of the basics. But then we really focused on how they can most efficiently access their transportation needs for their patients. We gave them education on how to navigate our online tools, how to find guidance, again, where to locate their resources. And we made sure that those facilities, those dialysis clinics across the state were able to easily make use of those tools. And we provide ongoing support to those clinics. We have our field team conducting regular weekly check-ins to provide that ongoing support and keep that communication going. We've assembled now, Anna, I'll let you know that we've assembled now the FAQs and video clips that we're going to send out to the dialysis clinics. So this way they have access to that as an ongoing reference and resource. We talk a little bit about the relationships between transportation providers and facilities, and really that's key, right? Not only was this proactive outreach and the communications we had with stakeholders so very important, but the building of the relationships between the facilities and the transportation providers was also key, is also key during this uncertain time. By facilitating those regular communications between the transportation providers and the facilities, we cultivate that relationship and ensure that both MAS and their preferred transportation providers are knowledgeable about the concerns at each of the clinics, because depending on where they're located compared to a very urban area like New York City, and then to some of the vastly rural locations that we have across New York State, some of the challenges can be unique. So we made sure that the transportation providers understand those unique challenges of the facilities that they work with so they can meet those needs. And just like we do with all of our medical providers and transportation providers during this time, we continue those wellness checks. Again, just to keep our fingers on the pulse as we move through different phases of this pandemic to really ensure that the needs of the facilities and their patients are being met. So hey, Rob, Brian, do you want to go ahead, sir?
Yeah. Let's get a little feedback here. If everybody could mute. I did want to mention one of the things that is unique about MAS is that we have a full-time medical director. Dr. Leibowitz is on the line. The key with that, in my opinion, is especially with dialysis facilities, sometimes there needs to be a clinician-to-clinician discussion. And I think oftentimes in transportation, we aren't always thinking that, and yet the members that are being transported to and from dialysis facilities are absolutely needing that critical oversight. So I think that, Mickey, I know that you have built a good relationship that we have with our dialysis partners. Can you speak to that a little bit? It may be your line that's getting the background noise. Nope. I think that's the line. Dr. Leibowitz, I apologize. We'll probably end up putting you on mute. But anyway, that is an added piece that is a part of this. I think his relationship with Anna Bennett and the dialysis clinicians, as well as our managed care organizations, it always pays a benefit to have Dr. Leibowitz in on those discussions. I just want to kind of wrap up. We have our contact information for both the Department of Health as well as MAS. We put Brian's name and phone number and email on there. We appreciate everything these, especially the southern and Midwestern states, are going through. I think we went through that. I think you guys are in the middle of it. If there is anything that we can do to help share other best practices, kick around different ideas, anything that we can offer. And again, I want to thank the Department of Health for being with us, number one, on this call, but I give credit to them for putting us in a position to partner for, at the end of the day, the enrollees, the members, making sure that they are being taken care of during these turbulent times. And so I would say, Alexandra, without further ado, I'll pass it back to you.
Thank you. I see that Annette Roberts has her hand raised. I'm going to unmute that line. Annette, I think your line is now open. Do you have any questions for the speakers?
No.
No, okay. I'm going to mute you back up. If you have any questions, I haven't seen anything come through chat, but you can submit them now, or you can also use the Q&A feature. And I want to thank all of us, or the speakers today, to presenting this information. I just wanted to, I had some dialysis leadership reach out privately in chat, and I wanted to clarify that we invited their dialysis provider leadership to this call, but we also extended this invitation, this call, to transportation brokers, transportation drivers in our state. So if you are having any transportation issues in the state of North Carolina, South Carolina, and Georgia, I am Anna's equivalent here at the Network of the South Atlantic. So feel free to reach out to us. I put my email address in chat, and I will distribute the slides and recording to everybody who registered today for the call, as well as our state partners are able to distribute these into a broader audience for transportation brokers and providers. I think Evelyn has her hand raised. I'm going to unmute that line. Evelyn, do you have a question?
You answered it. You stated that you were going to give us the PowerPoint.
Yep. Yeah, no problem. All right. All right, so I'm going to move us forward. I just wanted to share, especially for dialysis patients, the network has put together a series of handouts for transportation education for patients and staying safe, and some considerations for transportation during COVID-19 pandemic. So I put the hyperlink in the slides that you will be receiving. So if you are either a dialysis provider or a transportation provider that just want to review what is the message that we're giving to dialysis patients, these are available for you to review, and it also has our contact information. And just to let you guys know, after this webinar is closed, you're going to get a quick survey about 5 questions. We just want to gather some information if this webinar was helpful for your practice, and what other information are you seeking to cover for dialysis patients that we might want to cover in a future webinar. So please let us know so that we can work with our partners on that. So thank you, everybody, for joining us. I don't see any further questions. So thank you for speakers, and thank you guys for joining us. Have a great day.